I'm Mark Tait. I'm an orthopedic surgeon who's a hand and upper extremity specialist at the University of Arkansas for Medical Sciences. In fellowship, we had the excellent opportunity to get training in very specific areas in hand surgery and upper extremity surgery, especially in nerve surgery, in both looking at complex injuries of the peripheral nerves and also injuries of the brachial plexus. And in doing that, we had the opportunity to travel both internationally and both to work in our fellowship in these areas to look at very complex problems that are only treated in very few places in the country and to become very proficient at dealing with those issues. One of the most common peripheral nerve issues is a carpal tunnel problem, and we see patients with that all the time. And we've learned the philosophy in fellowship that the least invasive surgery is usually the most beneficial for patients, and so we try to really in fellowship work on treating the patient as a whole, because every problem, though it may be the same problem, is specific to a patient and their individual needs. And so especially with nerve problems and issues with nerve injuries, you really look at the whole patient on what they want, where they're trying to get to, and what their expectations of their outcomes are, and then tailor a plan for them and their own specific needs and their own wants and their own desires of where they want to go with their function. Peripheral nerve injuries are a common thing treated by hand and nerve surgeons. The most common type of peripheral nerve injury that we see is carpal tunnel syndrome. Many patients have heard of this, and many patients are afflicted with this, and this is one of the most common things we treat. This is a compression of the median nerve at the wrist, and it's something we can typically treat with either non-operative interventions and both operative interventions. Other common peripheral nerve injuries include cubital tunnel, or the compression of the ulnar nerve at the elbow, and this is another commonly treated peripheral nerve problem. Other traumatic injuries that we treat of the peripheral nerves include complex injuries with motor vehicle accidents and motorcycle injuries. Other things we commonly see in our practice are fractures, and many people have hand or finger fractures and elbow fractures, and we oftentimes can treat these with surgery or with casts and immobilization. Our goal and our philosophy here is to get you returned to function quickly. The hand can get very stiff after a traumatic injury, and our goal is to tailor a treatment plan that allow you to move quickly to avoid stiffness and loss of function. So many of the things we see are patients who are weekend warriors, who play sports, or who are just active in their everyday life, and many work injuries which result in fractures and injuries to both the hand, wrist, and elbow. Another common injury we see are wrist fractures, especially in patients who sustain falls. These can often happen in middle-aged to elderly patients who have had falls and who have had injuries to the wrist that can be treated both non-surgically and surgically to improve function and quality of life. One thing that's very unique to our practice here at the University of Arkansas is that we, as hand surgeons, work very closely with the hand therapists, and we're going to open a new clinic location where the hand therapists are just right there across the hallway. And so this will give us the opportunity to benefit our patients and to really tailor their plans to both the therapy aspect and both the surgical aspect at the same time, working very closely and in conjunction with our occupational and hand therapists that are right there in clinic with us.